Hello, and welcome to the 2020 Virginia Garcia Memorial Health Center Annual Report. My name is Gil Muñoz. I'm the CEO for Virginia Garcia. You know, when the first COVID-19 case came to Washington County back in March of this year, Virginia Garcia had already begun planning and knew what needed to be done. It's what our organization was built to do. It's what we had somewhat unknowingly been preparing for since our founders launched this organization in a Cornelius garage 45 years ago. The people who built this organization designed it to adapt to the needs of our community. So thankfully, when fear and worry came with this virus, we didn't act out of fear. We came back to our mission. And I've never felt more proud or confident in this organization. As a healthcare organization, caring for our community every day is our top priority. And right now, more than ever, our communities need high quality, culturally appropriate care. We've learned a lot during this time. We're optimizing the use of technology to respond to our patients' needs. We also recognize the challenge posed by the digital divide and the need to work closely and creatively with our patients so they have access to the care they need. We've made these changes and have managed to keep our health center financially strong through public and private grants, charitable contributions, and negotiating favorable contracts with coordinated care organizations and the Oregon Health Authority. The events surrounding the death of George Floyd and the focus on racial justice has heightened our commitment to health equity and the recognition that as a nation, we have to address long-standing inequities that result in health disparities and poor outcomes for people of color. We will continue to work with community partners to address the social determinants of health and advocate for policies that serve to protect underserved communities. I invite you to take a virtual walk with me through the past 12 months. In the following pages, you will read about how our dental team, when their clinics were closed due to the pandemic, stepped up and out of their comfort zone by joining our primary care teams in providing much needed COVID-19 screening services right where our patients live and work. You will hear from patients that experienced the unwavering care of our primary care outreach workers after receiving a positive diagnosis of COVID-19. And you will find out more about the amazing work of our mobile outreach team who, while continuing to care for migrant and seasonal farm workers, helped launch 2 drive-through screening sites, making us the first community health center in the state to offer these services to the community. In the midst of a pandemic, it's our job to serve our patients the best way we can. Thankfully, we've been preparing for this for generations. We were ready because this is what we do. This is what we've always done, and this is what we will continue to do, no matter what comes our way. As we look forward to 2021, we will continue to be here, adapting to the changing needs of our patients and advocating for the health and safety of our communities. This is what a community in action looks like. It's all of us adapting to a new normal, finding different ways to connect, and continuing to look for ways to help. Thank you all again for bringing your care, your resources, and your hearts to our work. 2020 has been a year we will not soon forget, but together we will continue to fight for those things that are important and provide the high quality care our community has come to count on. Thank you.